我现在好激动啊，想跟大家公布一下啊，你们看看谁来了，我们亲爱的 Dr. Carolyn Mcmakin 现在来到了我们的现场，真的好激动啊。谢谢 Simon 的邀请，来我们把话筒交给你。Hi Dr. Carolyn Mcmakin, welcome to our seminar. Thank you for coming.
Oh, thank you for having me. It's perfect timing.
I'm so excited.
Well, thank you. It's good to be with you.
Yeah, thank you. Dr. Michael Chen, do you want to say hi?
Hi, hello.
Hello,
how are
Dr.
you?
Chen.
I'm sitting in Taiwan.
Yes, you were in Taiwan?
Yes, I hope I have a chance to invite you to come to Taiwan at once.
I love going to Taiwan. We have done 3 courses there for the hospital in, I think it was in Taichung with Dr.
Really?
Daniel Wang.
Okay, nice. That's great.
At the hospital. It was really wonderful. I love Taiwan. Yeah.
Hope to invite you once. I hope, yeah, in the future. Thank you. Give the microphone to Simon. Thank you.
Let me just translate a little bit for Dr. Carolyn Mcmakin. It's such an honor to invite you to have you with us in our today's Zoom call. I'll just translate a little bit in Chinese first. 那我们今天真的非常荣幸可以把 Carolyn Mcmakin 医师邀请到我们今天会议的现场。他现在是在美国的 Oregon Portland。那他现在刚刚下班，在诊所还是在忙碌的做一些文件的工作。然后我刚刚就跟他联系上，给他请过来这边跟我们大家 say 个 hi。那我们刚刚 Michael 老师也跟 Carolyn Mcmakin 医师跟他有打了招呼。那 Carolyn 医师说他也是非常喜欢台湾，因为 Michael 老师跟他说他现在在台湾。那 Michael 老师在过往Carolyn 医师他目前过往也在有3次的机会去过台湾，在台中的一家医院跟 Daniel Wang 医师一起来合作去经营这个去教导这个 FSM 这个技术。So I'll just translating Dr. Carolyn Mcmakin, you're very in love with Taiwan and you have been there 3 times and we're glad to have you with us today. If you have a few minutes, I don't know if you would like to share with us a little bit about anything you'd like to share with us, or we can have a Q&A session. I don't know how much time you have with us today.
I'm here at the clinic and I'm happy I can answer questions, or I can I don't know how much you've already said about the Mag-Healy. We use 2 frequencies at one time, which is different than the Healy.
Yes.
One frequency is targeted at specific tissues, and one frequency is to neutralize or balance an interference pattern with the proper function of those tissues. So together, the 2 frequencies seem to produce a very powerful effect to make people more comfortable and to balance their, what do we call it? The bioenergetic field.
Bioenergetic harmony, yes.
Yes.
So 我们刚刚说到的就是有跟大家分享过关于 Carolyn Mcmakin 医师的这个 FSM 的技术，它是一个双频的技术，它有同时会释放出2组频率，有一组频率呢，它是会针对某一个组织某一个身体某一个部位，那另外一个频率呢，它是会帮助去平衡那个部位的一些一个状况，所以这2组频率结合在一起的时候，它会产出一个非常强大的一个共振效应，去帮助我们让我们去恢复这种的身体的一个幸福感，或者是提升我们这样的一个帮助我们去恢复这个平衡，还有我们提升我们的舒适度。
Good. Makes me wish I spoke Chinese.
我有问题好吗？那现在是这样哈，那个真的很荣幸，我很兴奋哈。那想问一下那个 Dr. Carolyn Mcmakin， 就是在Mag-Healy 里边，这有一个 water application。Marcos 经常在跟我们说哈，这个就是水的这个 coherence 的重要性。那我想知道一下，我们在 Healy 里边，我们用线圈做了一些就是能量水，同时呢，我们有这个诺诺妮娜先生呢，他也有这个水哈。那我想知道一下，线圈做的这个能量水，还有诺诺妮娜的这个水，以及你这个 Mag-Healy 里面的 water application， 它们有什么样的区别可不可以跟我们讲一下？I know it's all Greek to you. Waiting for Simon.
Simon, translate.
Okay, so Stella is actually the founder of our team of Coherence, and she has a background in acupuncture and also in massage therapist. She has many years of specific trainings as well. So she was just asking, because inside Makili, there's 4 modules. One of the module is the water application. I'm not sure if you're a little bit familiar with the water application, because have you seen the Healy coil? Because using coil, we can also make energize the water with coil. But with Makili, there's also the water application to energize or to inform the water to make it more coherent. So when we drink it, it also helps the cells or our body to absorb this coherent water. Do you have any experience or any knowledge you can share with us about the waters? Or
we have actually been using electrical pulses rather than magnetic pulses we would put the electrical leads from microcurrent in water, and we've been doing that since 1998. So for a very long time, and we found that the water will hold the pattern of the frequencies for 12 hours for certain. It diminishes over time as the random pattern in the water removes the coherence, but 12 to 24 hours it will hold. And on some patients, especially very sensitive patients, it's more it's easier for them because it's not as strong, it's milder if you put it in the water first, and it's as if it gets the body accustomed to accepting the pattern of the frequencies, because the body is 85% water, and water is how the body communicates within itself. Water in your body turns your body into a semiconductor.
Yes. So you would put the microcurrent frequency, you would help to transform the water and let the patient drink it? Okay.
We have some practitioners have children who play sports, and they put water to prevent injuries, water to treat head injuries. They put those frequencies in the water that the girls drink during the game. And so there is an entire generation of children who have been raised drinking microcurrent water for their sports for 15 years.
15 years.
They started when they were 8, 10 years old, and now they're in medical school. They consider it normal.
Wow. Okay. Let me just translate that in Chinese.
Yeah.
所以刚刚Sarah老师问的问题就是那个水的这个部分那 Carolyn Mcmakin 医师他说他们在他们临床的经验当中其实用微电流频率，我们都知道说微电流频率它可以在我们身体里面其实可以维系大约10到24小时这样的一个12到18或者24小时这样的一个时长。那但是如果说有一个客户他是身体会比较敏感的时候呢，他们就会把这个微电流频率把它打到水当中，让他的客户去把这个水喝下去，这样子可以让他可以去吸收下来。因为就是说，因为水是我们身体里面非常重要的一个部分然后它可以透过这个水，其实在身体里面有85%以上都是水，然后水可以帮助我们去这些细胞之间的沟通这些都是透过水可以很好的得到帮助。他刚刚也分享了，就是说在他过往的经验，他有认识一些朋友们，他们是就透过微电流频率的这个饮用水来从小时候就8岁的时候就帮他们小朋友来去给他们喝这些频率的微电流的频率的水，让他们可以有得到一个很好的一个运动的表现。那已经有15多年的时间，是很好的一个方式。 But my next question would be like, how would you put the microcurrents or frequencies to inform the water? Do you like wrap the leads around the glass of water? How do you do it?
We drop the leads into the water.
Oh,
we
wow.
clean the leads. And so at our advanced course in Phoenix, we have 5-gallon water dispensers, and we put the frequency for emotional relax and balance in one. We put the frequency for brain fog, or I think you call it, I'm not sure, brain balance is a concussion protocol. We put that in one jug, and we put brain fog or clear thinking in the third one. And the practitioners will go and choose what they need. So if something has upset them, they will choose emotional relax and balance. If they're having trouble focusing, they run clear thinking. And if they have just traveled or are under stress, they'll run brain balance, is what we call it on the McHealy. So we have been doing this for probably 18 years now into the water.
Wow, 18 years. Okay, let me just translate that. That's amazing. 所以 Carolyn Mcmakin 医师，我就问他是怎么样可以把那个微电流频率打到水当中呢？他原来是用贴片的方式把那个贴片清洗干净，直接把贴片放在那个水当中，然后开启这些微电流频率，就可以把这个水让它充满这个能量跟频率。那他们在之前在美国 Phoenix 开讲课的时候，他们也会在现场准备好几壶不同的水比如说是有5 gallon 这样的一个水，然后呢在里面他会做不同的能量水，比如说他有一个是心理平衡的，有一个是情绪的，有一个是让头脑可以思考清晰的一点不同的这些频率的水。然后当有一些学生可能觉得有一些比如说头脑不清醒或者是觉得情绪有点不稳定的时候，他们就可以自己去倒这个水来喝。那这个已经持续了18年的时间。It's really mind-blowing to hear how you make the
amazing.
And the first time we did it, we did an experiment in my office, and I didn't tell anyone that we had run the, I think, concussion protocol or emotional relax and balance. We ran something into the big 5-gallon water jug that was in the hallway. And my bookkeeper is a normally very quiet, shy. Her password is Mouse, Ms. Mouse. So she's very quiet. And she came and got a glass of water, did not know that we had done anything to it. And 20 minutes later, she's in her office singing and making happy noises. And then after about 10 minutes, she came out and she said, "Did you do something to that water?" And we had to tell her, it's like, yeah, we did. So that was our first blind trial on running frequencies in the water.
Yes. Wow. Let me translate it for the audience. 他说 Carolyn Mcmakin 医师说，我们说真的非常听得目定口呆就是有这样的一个方式可以去为水去充电。那他说其实他们最先发现的这个方式是在他自己的办公室当中，他就去实验下是不是真的能够这样做。他的办公室当中有一个员工呢是非常内向的，像文静的，那他有一天就去把这个水倒来喝，那平常都不太讲话的这样的一个员工，喝完了这个水大概是20分钟之后，他怎么发现说他在办公室里面开始唱歌开始很轻松的这样在跳跃活动了起来，就觉得非常的神奇。那这个员工就来找 Carolyn 医师，就跟他说，你是不是在这个水做了什么，下了什么东西？然后说是我们在水里面做了一个频率。Yeah, so we did put frequency into the water.
Magic water.
Dr.
So
Carolyn,
that's how we knew it worked.
Yeah.
Yes. Mm-hmm.
I was just telling the audience, actually, I was because I was trying to convey in this today's seminar, it's not just about the FSM technology, but I was also trying to convey the message and all the years of your practice is through like actually testing, through experimenting, through documentation, error and trial. I really admire your patience and your love and your compassion towards your patients. And you're like a reporter to the war zones. You're basically like, this doesn't work, this works, and you keep trying, you never give up, and you give up all the time that you could have spent with your family and your family. Like you give up everything just to develop this frequency protocol, and we really appreciate to have you with us to develop.
Thank you. Well, once you find out that you can do this, if someone comes in and their pain is a 7 out of 10, and you do something and their pain goes to a 0 or a 1, how could you not continue? It would be wrong. It would be immoral, unethical to stop. So it has been, because my background is science. The methods of science are to do something, observe the result, repeat, observe, document, make it. There are times when I have students operate the machine, so I don't know what's being used. And that's how we started for 1 year. I would have students operate the machine, and I would, that doesn't work, that doesn't work. The machine was off and I didn't know it. No, that didn't work, that works. So that year we spent, and I was committed to know, determined. I was determined to know if the effect was real, or was it because the walls in my clinic were pink and I'm a nice lady? Is it placebo or is it real? And we found it took 5 years to 2 years to think it was real and not placebo. It took 5 years to find out for sure that it was real and not placebo. So
all your patience and your love, your compassion and your determination really pays off now.
Yes.
Your patient is so lucky to have you.
It's really deeply touched everybody. 应该说在我过往的20多年的职业生涯中我觉得我最大的遗憾就是认识 Dr. Carolyn Mcmakin 晚了。在读你的书的时候，我记得我跟Simon我们曾经说过我们两个那次非常 emotional 在说，就是 Dr. Carolyn Mcmakin 终其一生把所有的他的一生的经历，他的所有的爱呢，都贡献给他的病人，甚至他都不失去他的婚姻所以每看到这些，像你像就是您和那个Marcos 都是这样，为我们来说是一个榜样，真的榜样的力量是无穷的，而且我觉得真的是让我觉得是你的这种精神是直接去 touch 到一个人的灵魂深处的。
Stella was just saying your love towards the patients or the humanity and your spirit to help everybody is really like a role model for all of us. And Stella and myself, we are both actually a registered massage therapist as the manual therapist. And Stella was just saying, she really regret, like if she known you 20 years ago, I think it would completely change her practice.
And also lots of benefit for my patient as well.
Benefits for your patients, So let me just say a little bit of that in Chinese. 所以我刚刚跟 Carolyn Mcmakin 意思就是，其实也跟他大概说了一下我们今天刚才稍早的会议，其实除了今天的这个会议，希望让大家了解到 FSM 这个技术之外，其实我很希望再透过今天的这个会议让大家去感受到 Mcmakin 医师，他在过往这20多年来的这种的无私奉献的这种精神，去帮助大家，去帮助大家去研发出来这样子一个 FSM 这套系统，真的需要很多的毅力、意志力、决心、爱心，还有很多的这些勇气，去不断的去探索。因为在这个探索的过程当中，他刚刚也说到了，他整整花了2年的时间，不断的去摸索、跟探索、跟验证，其实他这个频率的这个共振效应是否是真实的，还是只是他想象出来的。他也透过他的学生去操作这些仪器，在他完全不知道任何频率或是有没有开机的情况下，这种的盲眼的这种测试来去看这个频率是不是有效的。他也另外花了5年的时间来去整合，说哪一个频率跟哪一些有什么样的一个功效，可以对什么样的一个共振产生一个效应。所以真的是一个非常，我觉得是一个非常好，这是一个漫长的一个研发的一个过程。他也说到了，就是我说我们很敬畏他有这种的精神去造福人类，就像马库斯先生也好，就是为了我们人类的一个生活品质也好，我们的意识的提升也好，做出很大的贡献。他就说到了，其实当你看到你的病人从进门的时候是可能1到10，他的疼痛点是7的时候，他出门的时候他的疼痛点可能已经降到0或是1的时候，如果你看到你的病人有这样子的一个变化，你可以忍心的不去把这个技术分享出去给更多的人吗？其实跟我们 Healy 也是一样，我们 Healy 知道说 Healy 的威力这么强大，其实我们不出去分享的时候，其实是为我们的人类，为我们的身边周围的人带来一个其实是违背自己的良心，可以是这样说吧。So I just translate all that.
好啊。我想说的是我知道那边已经很晚了，但是对于我们来讲，这是一个非常难能的机会希望那个 Dr. Carolyn Mcmakin 给我们一点时间我有几个问题想问一下，就是 Marcus 曾经在 Orlando 曾经说过就是我们 Healy 里我们的经络是根据刚才你说那个 Dr. Wall 他的那个20个程序来做，那就是在我们的手表程序子午流注还有那个我们的就是 Nononina 的自然周期里边也是按照就是中国中医的这样12经络来走。但是 Marcus 同时也透露了在 McHealy 里边他的经络是特别的是非常 deep 的。那我想知道一下，可不可以给我们说一下它有什么区别
Dr. Carolyn Mcmakin, I know it's pretty late there for you right now and you just finished work and you might not have your supper yet, but really, really appreciate and excited to have you with us. Could you spare a little bit more time with us?
Oh, sure. I'm just texting my sister telling her I'm still alive. Yeah.
Thanks a lot.
I'm at the office on a Zoom call.
Yeah. Stella was just asking from previous meetings with Marcus to share about McHealy. He always mentioned McHealy is very special. It's electromagnetic, but it's also based strongly on the meridian system. So since Healy has different meridian programs, like from Dr. Vo, we have different meridian programs, and according to the Chinese tradition, we have different times using corresponding to different organs. Would you be able to share with us a little bit how electromagnetic or the pulse PEMF or this technology, how does it work with the meridian system? Do you have any meridian pathways? Yeah.
When we use FSM, so when there is a professional version of McHealy that can be programmed, what we found, I think it was in 2003, so almost 20 years ago, we had acupuncturists at the meeting who were trained in China, and they would do pulse diagnosis.
Yes.
And so the patient was a practitioner, also an acupuncturist, and she had a very damp spleen, deficient qi. And so we ran the frequency. So we put a contact at her neck and a contact at her feet, and we ran the frequency for damp, congestion, and then vitality, and the spleen pulse came up then to normal in 10-15 seconds. Then the pulse for the kidney was weak and deficient. So we ran vitality in the kidney, and in 10 seconds, the kidney pulse changed. Then we went back to spleen. It was weak again. And the acupuncturist who was trained in China said, the lung is the mother of the kidney. Yes. I don't know what that means, but she did. So we ran sort of reboots for the lung, and we ran vitality in the lung, and all 3 pulses stabilized. Wow. That was 2003. So those programs are not on the Mag-Healy because the Mag-Healy is for the public. When you treat an acupuncture meridian, it is so important to get it right. You need to know what you're doing because the acupuncture system is so important. So this is not something that you would sell to a patient or an untrained person. In 1 or 2 years, when there is a professional programmable version of the Mag-Healy, then I can put in protocols for the meridians that we have frequencies for. The frequency for the organ associated with that meridian is what changes the pulse or the meridian function. So lung frequency is the same as for the meridian lung, kidney, spleen, heart, pericardium, kidneys, gallbladder, bladder, all of the organ-related, conception vessel and governing vessel, and triple warmer.
It's very complete.
Yeah, we don't have an organ for that.
Yeah.
Okay,
let me just translate that. So 刚刚 Mcmakin 医师的回应就是说，其实他透过 FSM 的这些频率当中，他也尝试过应用在透过这个经络的系统，因为在有一次培训课程当中，有一位学员他是有受过中医的这个培训会懂得把脉的。那在那个会议当中呢，他们就发现有一个学员，他的那个 spleen 应该是脾脏的那个经络，那个比较淤堵，然后比较湿气比较重。他们就尝试试验了用那个脾脏的这个频率的程序去帮他去做一个调整。那在10到15秒之后，他们再去帮这个学生去把脉，就发现说这个脾脏的这个气就回来了，提升了。那后来他们又去进行这个肾脏这方面的一个频率来去帮他去好像是增强他的活力，但是他们发现说10到15分钟之后肾脏的这个活力提升了，但是脾脏的这个能量又下去了。那透过这个中医的这些理论，他们就发现说原来就是要调整，需要去调整这个肺部的功能，因为肺部跟肾脏是有很强烈的一个关联，所以他们就去跑了一个应该说那个肺部是很重要的，那肺跟肾脏也是很重的关联，所以他们就跑了一个重新设置这个好像是去调一下这个肾脏。那调完这个肾脏之后呢，他发现整个肾脏、肺或者是脾脏的功能都已经上来了，所以这是真的是一个非常神奇也好，非常的快速的一个转变。那因为这些特别个别的经络或者是胰脏的这些不同的脏腑功能的这些程序需要有一些专业的培训，因为你用错频率其实对身体是有一些反效果的。那也许在将来有专业版的 Mag-Healy 的话，他会愿意的把这些频率也分享到这个专业版当中。那目前 Mag-Healy 当中呢像是日常使用，就是给一般用户使用的话，大家就是不会去用到这些比较专业的这些频率。